Hi, everyone. My name is Ashley Fritz, and I'm the Marketing Director of Diamond Drugs Incorporated. Thanks for joining us for this special episode of PodcastRx featuring our Chief Executive Officer and owner, Mark Zilner. This month, Mark will be inducted into the Indiana County Chamber of Commerce Business Hall of Fame here in Indiana County, PA, where our corporate headquarters is located. He follows his parents and company co-founders, Gilbert and Joanne, who were part of the inaugural class of that same honor back in 2015. As someone who has worked for Diamond since the early 2000s, I can speak to the character of Mark and his parents. There are many of our nearly 1,000 employees who have been a part of the Diamond family for decades, and that speaks to the Zilners as employers, as people, and as friends. We couldn't be more proud of Mark, and there isn't anyone more deserving of this achievement. Please enjoy this interview where our own Adam Campbell talks with Mark about Diamond's past, present, and future, as well as those family roots that have shaped Diamond's story. Thank you for listening.
From Diamond Pharmacy Services, this is PodcastRx, a monthly show that takes you behind the counter of the nation's largest correctional pharmacy provider. We bring you conversations with pharmacists, nurses, managers, and other Diamond staff about the topics and issues we see in corrections, long-term care, and community health settings. Our chats aren't limited to purely pharmacy topics, and they aren't strictly clinical either. So if you're a healthcare provider or just enjoy healthcare podcasts, we think you'll enjoy this show. On June 23, 2022, Diamond Drugs CEO, President, and owner Mark Zilner will be inducted into the Indiana County Chamber of Commerce Business Hall of Fame for his contributions to the local economy, leadership, and business. Since joining his parents' company over 30 years ago, Mark has helped Diamond grow from a largely local business into the nation's largest correctional pharmacy provider and one of Pennsylvania's largest long-term care pharmacies, and as a result of that growth, one of Indiana County's largest employers. Mark has also been instrumental in the creation of Sapphire Health, an electronic health record and medical records developer, RemedyRepack, an FDA-registered drug repackager, and InnovaScript, a mail-order retail pharmacy. These business achievements aside, the Hall of Fame induction is also a big deal for Mark as he joins his parents, Gilbert and Joan Zilner, who were enshrined in the Hall of Fame's inaugural class back in 2015. On the occasion of this induction, we wanted to talk with Mark about his road to success, why he chose to be a pharmacist, why he joined the family business, what motivates him as an entrepreneur, his visions for the future, and of course, so much more. I am Adam Campbell, and this is PodcastRx. It's my great pleasure to welcome Diamond Drugs Inc. Chief Executive Officer, President, and owner, Mark Zilner, to PodcastRx. Mark, you are by far the highest profile guest that we've had on this show, and I can't thank you enough for taking time out of a never-ending busy schedule to be here with us.
Well, Adam, it's my pleasure to be on the show. You've had a lot of great guests over the years, and I'm honored and looking forward to sharing some of my experiences with you today.
We can't appreciate it enough, so thank you again, Mark. We wanted to have you on the show because later this month, you're going to be inducted into the Indiana County Business Hall of Fame for your accomplishments and your leadership of Diamond. And on a special note, you'll join your parents, Gilbert and Joan Zilner, who were enshrined in the inaugural Hall of Fame class back in 2015 for their accomplishments with Diamond. And you joined this company full-time out of college over 30 years ago and eventually took the business over from them. So really, it's not a stretch to say that Diamond has been your life. And as cliche as it is, I think we need to go back to the beginning to see how you got here. So can you tell me what it was like to grow up around the drugstore with both parents and even your maternal grandmother as pharmacists? What are your earliest impressions of pharmacy as a career?
Well, my parents bought the pharmacy when I was 3 years old, so I was exposed to it at a very early age and remember visiting the pharmacy quite often and seeing my parents work. My grandfather also worked there as well, and knowing my grandmother was the first female pharmacist in Indiana County, pharmacy was really in our background. A couple great uncles that were also pharmacists, so pharmacy had a special place for me. I enjoyed walking into the store and seeing my father and the other pharmacists helping people and giving them advice and really making an impact on their lives. And so to me, it was special. I saw how hard they worked. It was a very active and busy corner drugstore. And also as kids, my brothers and sisters liked to go in there because we had full access to the candy counter and were able to to get candy bars and such, but always amazed. It was sort of a special place just to see, outside of being at home, what my parents did and where they earned their livelihood. So special memories of those early years.
With all that said, when did you know that you wanted to become a pharmacist? You wanted to be behind the counter like your parents, like your grandmother, like your great uncles. Was there a flashbulb moment, or was it just a gradual realization, or did you really not have to think about it? You just knew that's what I'm going to do.
Well, I do remember the moment that I have decided, out of 3 other siblings, I'm the only one that went into pharmacy. Mm-hmm. My parents never pushed us, never allowed us all to make our own decisions. But I grew up working around the pharmacy. I would make deliveries of medical equipment. I would deliver beds. I would go to nursing homes and clean their equipment. I would deliver prescriptions. I would work within the pharmacy. So I was really exposed to it. And I think the turning point was, I remember my father taking care of a patient, and he spent a lot of time reviewing their medications with them and just talking to them and helping them. And I saw how at ease that patient felt, and made a comment that, my doctor never tells me what the medications are for. You've helped me so much. You've really helped me with my health care. And when I saw that and the impact that you can make in people's lives, it really affected me to say, this is the profession I want to get into. So at that moment, I decided that's what I wanted to do.
That's really special that memory sticks with you after all that time, and just the importance of pharmacists and patient care. It's something we talk about on the show with other guests, but and something we always come back to. But to know that had such a role in you becoming a pharmacist is really, really neat to hear.
And I think that's really been the backbone of Diamond. First and foremost, we are a business, but first and foremost, we want to take care of the patients. And we've developed our clinical team. We have our technicians that race to get orders out to us. Getting the proper med to the patients at the right time is very important. And then being involved in those clinical decisions to make sure that we work with the doctors as a team to coordinate the best care for the patient, to look at lab results, to look at side effects, and really pinpoint and help the patients, because ultimately our profession is first and foremost to benefit the patient and be as good as we can be. So I'm really proud of that, and probably that early childhood memory stuck with me over the years. So I'm grateful for that.
Absolutely. Well, moving on from early childhood, you said you were 3 years old when your parents bought the pharmacy, moving to when you were going to be a pharmacy student yourself. I'm curious, Mark, growing up here in Indiana, Pennsylvania, you have 2 renowned pharmacy schools with Pitt and Duquesne. Your parents are famously Duquesne alums. 2 renowned pharmacy schools just an hour and change away from home here. I'm curious, what made you want to go up to Boston, to Northeastern University, to study pharmacy there?
Well, both local schools are wonderful schools. And actually, I did spend 2 years at Duquesne University.
Okay.
And I really liked the program and the reputation that Northeastern had. And honestly, it gave me a chance to get away from home, per se, and explore the world a bit. And I think that really helped me. Moving to a new city, a big city, not knowing anyone there, you learn to fare for yourself a bit.
Yep.
And I got some great experience that I'll get into with some of my internships that really helped affect what I did at Diamond. And I think that's very valuable. But Boston is a great city. That was a great school. And, it, again, really allowed me to spread my wings a little bit and take, a little bit more control over my destiny, I think, and allowed me to fare for myself a little bit and make things properly happen, I guess.
Right. Well, speaking of destiny, so when you started pharmacy school, were you thinking, I'm going to join the family business? I mean, you'd already mentioned that you'd been helping out. You've been doing numerous things, delivering prescriptions, medical equipment, all that. So did you think, well, I'm going to go to pharmacy school and I'm going to bring back what I learned and I'm going to join the family business? Was that your plan from the beginning?
Yeah, that was always my plan and my vision once I decided to go into pharmacy, that I would eventually come back and work and hopefully take over the family business. And didn't know at that time what we'd grow to or what we'd do, but first and foremost, wanted to be a pharmacist for Diamond, and the rest then sort of fell into place.
Yeah. You mentioned just briefly a little bit ago about internships that you had and these experiences at Northeastern. So what were you doing through your pharmacy education to prepare for coming back to take over the family business?
So unfortunately, pharmacy school doesn't really prep you that much in business. It preps you more, or at least when I went to school, more into the clinical aspect and the filling of the prescriptions. So basically, when the internships came up, I saw an opportunity, or actually requested an opportunity, of a pharmacy that I heard of up there by the name of Instacare Pharmacy. They were a large long-term care, closed-door pharmacy that really started the whole long-term care pharmacy industry. Now, my father had started it way back in, when he started the pharmacy in 1970, started servicing some nursing homes, so I was accustomed to that. But Instacare was one of the larger leaders. The owner developed the American Society of Consultant Pharmacists, so there was a lot of history there. They were the first to utilize the blister packs that are commonly used in most nursing home pharmacies right now. And I got to meet the company that had began making the blister cards for them as they would come in. So there was a lot of history, and I learned a lot and got to visit with the consultant pharmacists to the nursing homes and really learn a lot. And that's what started getting my brain thinking about how we could grow, what we could do, programs we could offer. And so it really gave me a lot of, sort of excellent experience. And at the time that pharmacy serviced 100 facilities, and I thought, oh my gosh, if we could ever get this big and service 100 facilities, things would be great. So I always looked to them almost like as a goal to, boy, if I could grow to become as big as Instacare, that would be a wonderful thing. So really great experience. And so halfway through school, I was already starting to think of ways to bring that knowledge back to the business and how I could implement some of those ideas within what my parents were currently doing.
Yeah, and that was a very wise choice then, again, to go to Northeastern, because you got a look. You were in the ground floor of those innovations in the industry.
Yeah, and all things happen for a reason, and it just helped to get me on that proper path.
Yeah. So when you graduated from pharmacy school, it was 1991. And as you said, your family had been operating Diamond Drug for over 20 years at that point, and they were already starting to expand away from being strictly a local pharmacy. You'd been in the corrections business since 1983, I believe, and also servicing nursing homes since the beginning, 1970. As we're sitting here now in this big headquarters for Diamond, we've got a 30,000 square foot, I believe, pharmacy right next door to us here, and this big campus that we're on. But when you started with Diamond, what was it like then? To paint a picture for people who know the business now, when you joined up full time, what did the Diamond look like in 1991 compared to the Diamond we know today?
Sure, Adam, and I'd like to start up in this response by basically stating that when I came in, my parents had a pretty good infrastructure set up. Mm-hmm. In 1970, when they started servicing nursing homes, that was very unheard of. Back in the day, people would come and pick up the medications at the pharmacy for their family members and bring them in. And back then, my father started taking those orders, delivering those orders, printing medical records, and just doing things other pharmacies didn't do, providing medication carts. And even looking back, it was a big jump when fax machines first came out. because when we picked up our first correctional facility, we would drive 45 minutes away to pick up the orders, take them back to the pharmacy, run the orders, and then go deliver the orders. So my parents bought their first fax machine for the facilities to be able to use. And I remember telling the first correctional facility that, hey, we have a fax machine. You can get orders in. They said, what's a fax machine? We don't have one. At the time, they were well over $1,000, and we had to buy a fax machine for them to facilitate orders. And that's sort of really what opened up us being able to be able to service more facilities. So at the time I came in, my parents were servicing, if I'm not mistaken, 3 states. We had about 20 employees. We filled probably 15,000 prescriptions a year. We had 1 long-term care location. And now we've grown into having 100 pharmacists, 1,000 employees. We're filling 16 million prescriptions a year and shipping to 47 states. We also added other divisions, such as 3 other long-term care locations in eastern Pennsylvania and Ohio, along with mail order, FDA drug repackager, and a correctional electronic health record. So walking in, there was a great base. My parents gave me good opportunity to come in and instill some of my ideas. But at the time, even at those 20 employees and servicing 3 states, they were considered a pretty big operation, and it was in its infancy, but a pretty developed pharmacy. So and things are much different and move much faster now. But for them to have that vision and set up what they did just gave me such a great base to come into.
Yeah, I would say so. So were you officially part of was your official start in the company just right after school, or were you already considered to be an employee? I'm just curious at that. And what was your first title when you joined?
Well, I did join in 91. I considered working in Boston for a year, and my father said, we need a pharmacist. You got to get back home.
Yeah.
So I jumped right in. I took a 10-day vacation and jumped right in from there. And I was a staff pharmacist in our retail location, probably for about 1.5 years. And I started in between customers and in the evenings working on bids and other opportunities. And then I just became a little too busy for the retail pharmacy life and moved down to our correctional division to check orders here and to work on some initiatives. I do really miss the retail end and the patient care and working directly with the patient. However, I felt when I moved here, I could help grow the business. I could help even make a larger impact, whether it be on nursing home patients or inmates, or helping to educate the doctors into the best therapy. You were able to actually service more people and help more people as well. But I do miss that personal patient interaction. However, I love what I'm doing today as well.
Going back to your ideas that you had for the business when you get out of pharmacy school, you talked about what you got to see from Instacare Pharmacy. In addition to that, what other fresh pharmacy school knowledge and lessons were you looking to implement when you joined full time with Diamond? And your parents, as you said, they had a great base for you to exercise those ideas, but you're still coming into an established framework. So sure. How did that go with throwing out those first ideas? How quickly were they to be implemented?
Yeah, it was a rather interesting transition. My parents always allowed me to make the decisions and do what I want to do. They said, make whatever changes you would like, and we'll support you. And we have had a great working relationship that they've been able to honor my ideas, and we discuss a lot of things, but we've never really had any arguments on what to do, and decided as a team, and they pretty much gave me free rein. It's always a challenge coming into a business where we've had companies or employees that have worked for our company for, let's say, 20 years, and the new guy right out of school coming in and sort of telling them what to do. And I was always very careful on how I did it, and intended to sit down with them and go through ideas. But it was a change of culture and such. And because you hear the cliche of, hey, this is how we've always done it. Yeah. But there was a lot of low-hanging fruit because I think as the company was growing, you concentrate on getting orders out the door and such. And when I came in, I had some not only new ideas on operational pieces, but also ideas on items to, service offerings to, give away, and coming in and adjusting pricing and being more competitive. Probably my first initiative, I was working on a prison proposal, and the secretary at the time was typing it on a typewriter. And the new guy coming in, after I read it, I had several changes, and she had to come back in at night to rework it on the typewriter. And I got a lot of resistance on just trying to implement a word processor in 91, which was relatively new technology at the time. So I was sort of known as, well, here's this guy that's going to change up my job a little bit. But it worked well when I explained to the employees. And when this employee had told me, after the next couple proposals that, hey, you were right, it makes my life a lot easier. I don't have to retype it. It began to really help and stick. But really coming in with a lot of other initiatives, such as changing forms and procedures, and also coming in and really setting the price. We weren't too popular with our competition because we were the ones that started in the correctional field acquisition cost pricing plus a dispensing fee. And our competitors were mad that we were exposing what we pay for the drugs. But we like to come in and be partners to our clients. And if they know the price of the drugs and we're making a small dispensing fee, we'll make recommendations for less expensive medications that cost us less, save them money, as long as they're equally as equivalent and help the patient. So I became a little bit of a market disruptor, and we started implementing other services such as software and reporting and other things that the others weren't doing, but I saw that there was a need. And we offered those at no additional cost. We came in with more competitive pricing. So we had many, many lean years because all of a sudden we were offering a lot more, than our bid required us to at our expense. But we knew it would help the patient. We knew it would help retain the accounts and give the best overall service. And I feel that if we can make things easier and more efficient and deliver the proper therapies, we're actually doing a good thing, and the nurses and medical staff then are being able to commit more time to patient care. So a lot of lean years, but really looked at it when I jumped in that, we would like to pick up a lot of facilities and grow as we could and not be the most profitable, but be the largest. And so again, my goal was to have 100 facilities, and like my dream when I worked at Instacare, and the services really took off. So I feel that some of the pieces that we implemented really shaped Diamond for the future. And sometimes it's being first to market with it and being innovative, but have learned our customers tend to try to catch up to us. We're sort of the innovators, and that we continue to be, and that's really what helped us, in our growth pattern.
I wanted to ask more about your vision for success for the company. Everything you just talked about, the business practices you were looking to adopt, and in your goal of 100 facilities. But beyond that, what additional visions of success did you have for Diamond in those early days? And what really was your definition of success?
Well, first and foremost, our goal was to be the best and concentrate on things that could make us better to our customers, provide the best care is of utmost importance. And the rest really followed. I had a vision to grow to that 100-bed facility level, and we passed that up pretty quick. And, and throughout all this, I'm not taking credit for it. We've had, not only did I have the good base to come into, but a lot of dedicated employees, especially a lot of the employees that came in around the time I did. They're still the leaders of this company, and they work hard day in, day out to make sure we're the best. And so being the best was the most important to us. But we hit a point where we were growing and expanding into states and working with a lot of healthcare groups, not only in the correctional but the long-term care space. And at one point, we had the vision to be the largest correctional provider, and we hit that mark several years ago. And to us, that was a pretty big goal. And as we started, we were the little guys. We had a lot of challenges first coming in. With those challenges, competitors that were much bigger than us that had better buying power. And again, I feel like we've really reshaped the industry in coming in and offering more and more services at a good price. And all of a sudden, our competitors took note of us, and many of them are out of business now. Many of them have been good and challenging competitors, but couldn't keep up. But we worked real close and hard in working on a minimal profit, trying to expand our services. And it's really worked well for us. So our vision was to, again, be the best, and then the growth came along with that.
On a personal level, what were you doing to make those visions happen, to be the best? You talked about working on bids at night when you were still working for the retail business during the day. What other things were you doing at those early days, the kind of hustle that you had to do to get things going?
Well, a lot of our team had worked around the clock, not only on the bids, but visiting customers, visiting healthcare groups. So spent a lot of time on the road, probably at one point about 70% of my time, getting in front of the customers, learning what's important to them, visiting the facilities, talking to the doctors, the nurses, the administrative staff on just what can we do to make things better. So we implemented a lot of those ideas, which some may just be a barcode order check-in or online reporting where they can go online and run reports based on patients' diagnosis and to be able to give them the best therapy. Also worked really hard on the clinical aspects to be able to come up with the most cost-effective and therapeutically effective formulary that really could help the patients. And I think, too, our work with guiding the physicians on what to prescribe and really being a partner in the patient care versus just giving them a piece of paper and reviewing everything with them on our quarterly visits really helped things. So I think on the clinical end and offering the best operational help that we can was good. At the same time, there were a lot of pieces internally because it's easy to promise these, but you have to make sure they work. So working to appoint people as managers, put people in charge of certain areas, hire people that could carry off these tasks effectively and make sure we get the medications out accurately and efficiently. So that also came along with lots of technology that we've invested into, and we continue to invest in technology to allow us to get product out as accurate as possible and as quickly as possible. And we're finding that within the industry, a lot of other pharmacies are struggling currently. There's low margins, and if you're not doing it as efficient as possible and running your company and managing well, that you'll be out of business just because the reimbursement is so low. So a lot of these initiatives have really helped us for not only the short term and growth, but also for longevity of our company.
Aside from the established pharmacies that you were going up against in the early days and their practices, what were some of the other obstacles that Diamond had to overcome to get to that level of success?
Well, some of the obstacles, to be able to financially make it happen when you're offering all the services at a good competitive price. Mm-hmm. But we found, too, the challenge is the larger you get, the easier it doesn't get. It continues to get very difficult. And found ourselves on the more services we offered, the more work we had to do, the more we had to maintain it, the more breakpoints that we had. So it really made us have to really totally control our business at all times and be on top of every program. If we're launching a program, we have to be ready for it and do it appropriately. So, again, the larger we get and the more diverse we get, the bigger challenges that come along with it. But we've been able to handle it and survive it pretty well.
Was there, in one of my last sort of history questions here, was there a business decision or decisions that you look back on that you and your family made that you can say that these were watershed moments? If we wouldn't have done this, we wouldn't be here. Is there anything like that in the Diamond story?
Well, I believe there are several. There's as I look, and my father decided to get into nursing homes and corrections. That really created a new market for us, and getting in very early, getting in at the right time allowed us to be a market leader. As I look at many of the retail pharmacies out there today, most of them are becoming a statistic. They're shrinking. The reimbursement is not there. And if they do not have a lot of size, technology, buying power, it's very hard to survive in pharmacy. So with my father getting into those areas early on really helped us to survive and allowed us to still be here. Those, of course, ended up becoming a larger part of our market to make us a national player. We continue to add other components as we added our Sapphire EHR, electronic health record for correctional facilities. That is growing amazingly, providing the best type of care and management for the patients. I'm convinced it's the best product out there, and our customers are realizing it too. So that has really helped us also in the market because we have additional offerings. So we've added other divisions such as repackaging. We have done that to allow us to provide stock to correctional facilities, but it has opened a whole new market for us for doctor clinics, athletic centers, school health. And so really a lot of these other pieces that our corrections needed and we utilize to best help them have opened themselves up to be their own market in rather large divisions as it is. Recently, we've been growing in our retail mail order directly to patients' homes. And I do see that as one of our biggest pushes for the future. We're going to continue to grow in all of our areas, but I see that as the opportunity in the world of managed care and such. So some of these have really shaped us, but I think the decision of getting into correctional facilities many years ago really helped shape our company.
Yeah, no doubt. I am curious, Mark, with all those experiences and being innovative and being on top of developments and new markets, when you were in the midst of all that, who would you say you learned from the most over the years?
Well, honestly, I would say from my parents and grandparents, they've always taught me to work hard. They've taught me to appreciate everything in life, and I think it really helped shape me. I would walk into that pharmacy at an early age and see how hard they were working. My parents made a lot of sacrifices for us as a family over the years. Not only financially was it struggle, but they had to work around the clock to keep the business afloat. And but they worked hard, and then on the every other weekend or every other Sunday when my father was off, as a family we always had an activity to do and spent family time. But really, their hard work ethic, I think, helped me to have that same ethic. And I do work hard and I enjoy what I do. And actually, my parents, who are in their mid-80s, they are still working every day. My father comes in 6 to 7 days a week, and it's in our blood. And we feel it's natural to be here, helping to grow the company and support the employees and the local economy. So I think that was some of my biggest leadership and instilled it in me.
I'm curious, Mark, when you talk about the lean years that Diamond experienced in the beginning to offer all the services but run on less of a profit at first, and the sacrifices that your parents made to keep the business going, and when did things start to turn over to become more out and out successful and a little less pressure filled, I guess?
I believe about 15 years ago, once we started having our volume and better buying power and more automation, that really helped us to lower our filling costs per prescription. You never really catch up because in the industry, our bid rates never keep up with some of the inflation rates that the medication costs are going up from the manufacturers quite a bit. So there's never a real comfortable spot, but it did. Some of the automation and our volume had really helped us to not be as concerned month to month on payroll. When my dad started in 1970, I mean, one bad week would have put him out of business and changed our future. So it continues to be a low margin, high volume, but us making the decision to bid lower than our competition and look at growing and getting into other fields helps to diversify and gives us the volume that allows us to survive.
Regarding that volume, so any visitor to Diamond here in Indiana, if you go into the corporate headquarters, the lobby, there is a little relatively unassuming plaque on the wall, but it says on September 18th, 2001, Diamond officially became the nation's largest provider of pharmaceuticals to correctional facilities. This is obviously, this moment stood out enough that you commemorated it on a plaque. I'm curious, Mark, can you tell me what you remember of achieving that milestone and just in that moment what it meant to you and your family?
Yes, I remember that very well. It was a very exciting moment for us. We were bidding on a large correctional group in Nashville. Very prestigious group. This group was using a pharmacy since the pharmacy's inception. This was their first correctional account, and that pharmacy became our largest competitor. They were the largest in the market. They were the leaders, sort of first to market. And based on our pricing and the service we offered, we put in a proposal. They asked us to fly down, that they had some questions on the proposal. We answered those questions. It was my parents and I and one of our lead pharmacists at the time, and they awarded us a contract. So as a smaller pharmacy, we picked up 50,000 patients our largest competitor lost 50,000. So that catapulted us to be the largest correctional pharmacy in the nation. And I as we were sitting at that board table, we just looked at each other and we were all very excited, and the flight home we were glowing, and it was sort of a special moment for us, that as we were always the little guys, always the guys doing the right thing, and never, always missing out on some contracts because maybe we were more honest than the next guy and honest with our pricing, and so it got to the point where we really felt like, boy, us doing the right thing and our honesty and all these programs we put into place really helped us achieve this goal, which was to the company very outstanding. And I remember when we made the announcement to the company, I thought there'd be fear because there would be so much more work to do for the employees. However, the employees were joyous and cheering on, and it was really a good feeling, and really felt like great teamwork that our employees wanted us to succeed and wants us to grow, even if it meant more work for them. And it was a large undertaking, and our staff worked around the clock to get this set up, and we hired a lot of new employees. So everybody really pulled together, and it was such a great defining moment for Diamond.
With all that in mind, with everything that you've built, your family and you, what about Diamond are you most proud of?
There are probably several things. I'm proud of our company's honesty, integrity, and in the care we provide to our patients. I'm also very proud that we remained 100% family-owned and operated. And above all, that I have had all these years to work alongside my parents, and which was, special for me. Even though it's work, it gives more time with them and allows you to work on things together. So that really is. And another thing that, this community has been great for us, and to be able to employ 1,000 people in the community, be part of their livelihood. It's a tough area. It was high unemployment, and we're one of the largest employers in the area, which, is important to me. This has been a great community, and to be able to help support our employees who support us. And, you hear a lot of stories by the employees, and some that have been out of work for many years, some that have not been able to afford furniture for their living room. And when you hear that Diamond gave me a chance, I love working here, I'm able to provide to my family, that's really what it's all about. It's not about as big as we are. It's not about how much money we're making. It's really being there and being able to, to employ these people, dedicated employees, and ultimately too, our employees team together not only to help each other at work, but also for the community. There's so much our employees do for the community, whether it's for homeless shelters, for food banks, for cancer. Our marketing division works hard to help put these programs on, and our employees all participate. And the sense of helping less fortunate people in our community, or even nationwide on some of these other initiatives, mean a lot to me. So us being able to give back to the employees and the less fortunate is a wonderful, wonderful thing.
With everything that Diamond does, whether it's what you just talked about, the employee culture and helping keep the community employed and to service, what do you think overall? What does Diamond do better than anyone else?
I really think it's our level of service. the compassionate care for the patients. There's many times on prescriptions or services where, we lose money, and that's not as important. The employees work hard to do what's right for the patient first and foremost. So I think that's the most meaningful. We do the right thing, and we care about what we do.
A little more question about you personally, Mark. So there was an article published by your alma mater, Northeastern University, about your success as an alumni. And you were quoted in that article saying that pharmacy is becoming more clinical and being an entrepreneur is difficult. And you continued by saying that young professionals must be innovative, diverse, and nimble to spot opportunities for staying ahead of the curve. You talked so much about your coming up in the business and being ahead of that curve the whole time. But 30 years on, how do you continue to be innovative, diverse, and nimble?
Well, I enjoy finding opportunities, not only with new business opportunities, but even new opportunities to help clients. So that excites me to be able to help and build something new and something that really does get to help and improve the outcome. So you always have to look for these opportunities. Several retail pharmacies don't, and most of them are a statistic now because they don't want to offer delivery, don't want to offer clinical services. And if you don't do it, the next guy will. So we've always looked to see about how we can be the trendsetter, the first in to be able to do something. And typically our competition follows. You can never rest and say you have enough business or, we're doing enough for a client. We always try to do the best and do better. We've continued to invest in technology. We have a multi-million-dollar expansion project of pill packaging, warehouse retrieval type system that has been in the build process for 5 years to help us stay competitive, be accurate, get product out. And, so it really, again, you could just never rest on what you're doing. You always have to look to the future and see how to be innovative or new markets that you can get into.
Well, speaking of the future, I'm curious, what are your goals and visions and dreams for Diamond and the affiliated companies for the next 30 years?
Well, we continue to want to grow all of our current divisions. We have several divisions that I feel have a lot more room for growth. We've always given the most attention to corrections and nursing homes. We do have some new leadership that have come in that have really helped us, and it's going to allow us to concentrate on other areas. I feel our biggest opportunity is in the retail mail order space, where we're providing medications directly to patients' homes. And we've been able to partner up with a lot of online companies that have niche products, and also into employer groups where we're the main pharmacy for a particular employer. Some of this would require us setting up a local network for the first fill, and then we provide mail order to the patients. We have software that we've developed that we can utilize for these retail programs. We've added telemedicine and some mail order labs to it. So in addition, offering medical supplies. So we can be either an add-on to a patient's prescription or for self-insured plans. We are the pharmacy that they will utilize for all these services. So really to become more diverse, there's a lot more opportunities when you're looking at the entire U.S. population to be able to service. And some of these programs are getting rather popular, and it's programs that we've started several years ago, but have put more attention in over the last couple of years, and we're growing with it rather quickly. So I see it more of a division of us continuing to grow into these fields and possibly other fields too as well. as we're looking to do more drug wholesaling to pharmacies and other pieces. So the larger we become, the more opportunities that seem to come to us. So continue to look for opportunities and growth and looking to remain independently owned for many years and, into the next generation and just continuing our growth path.
I want to wrap up this conversation. And Mark, thank you again so much for sharing your time with us. I see that we have 49 minutes here on the recorder, so almost an hour, but I've really enjoyed this conversation with you so much. And I've learned so much finally getting to talk with you in this space. But as we said at the top of the show, you'll be inducted into the Indiana County Chamber of Commerce Business Hall of Fame later this month. You're going to join your parents. They were inducted into the inaugural class back in 2015. And you're no stranger to awards. You've received Distinguished Alumni Award from your alma mater, Northeastern. You've numerous local awards here in Indiana County. But this award, this Hall of Fame induction, this feels different in comparison. Am I right to say that, given what it represents?
Oh, most certainly. It's quite an honor to be recognized here locally within the community by the chamber. It's where we live, where we have our livelihood. And again, with so many of our employees being employed here, it locally here, it really is rather special. Indiana County is a special place. We've had a lot of support over the years, not only from the chamber, but the local government leaders and the community who've been our customers that really have contributed to our success, whether it was, small business loans, grants, support that was needed. So the community has really, really been behind us, and to be recognized by our community is very special to me, and hits home literally. And as I look at it, I don't look at this award as Mark Zilner. I look at it as our employees, our company, everyone that's worked hard to create the success. I'm only as good as my employees. Maybe I come up with some ideas, but they're the ones that execute it. They're the ones that work hard to do it. So it's really, I look at it as more of an award for Diamond and all our successes with all our employees, and really to follow in my parents' footsteps of they were in the initial Business Hall of Fame class. Great to be within their company, in the Hall of Fame, and again, it's just an honor, and we enjoy being in Indiana County and continuing to thrive in Indiana County.
And of course, we hope for many, many additional years of thriving in Indiana County and continuing the very special thing that you and your parents have your parents started and you've kept going.
Well, thank you, Adam. I appreciate it.
And congratulations again on the award. And that's June 23rd, I believe you're being inducted.
That's correct.
So yes, congratulations on that. And Mark Zilner, thank you again so very much for being on PodcastRx with us. I can't tell you how great this was, and I hope you'll join us again for a future episode.
Thank you. I greatly appreciate it, Adam.
PodcastRx is a production of Diamond Pharmacy Services, the nation's largest correctional pharmacy provider. Catch our new episodes on Apple Podcasts, SoundCloud, Stitcher, Spotify, or wherever you listen to podcasts. Please rate the show and leave us a review. And if you have a topic you'd like to hear about on the show, or you'd like to share your thoughts on an episode, you can email us at podcastrx@diamondpharmacy.com.